Evening, good afternoon, and good morning. This is the 1895th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. PAVITRA Gaur. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathy lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. And from 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself, so that those who miss the session can watch it again. You can subscribe the same without paying any money. You can share it with your friends, and whether it be a homeopathic lover or student or doctor, it doesn't matter. What matters is to promote homeopathy among public. The purpose of the forum is to take homeopathy to every home around the world. And let me come to today's guest. This is none other than Dr. PAVITRA Gaur from Jaipur. She has completed MD and is a gold medalist at BHMS and working as an assistant professor, Department of Surgery, Swasthya Kalyan Homeopathic Medical College and Research Center, Jaipur. She has published many articles in various journals and interested in research and has presented some papers in this forum. All the papers were excellent. And today, Doctor will be talking about a very important subject, that is VIPERA, the Venus story told through segments and cycles. So we proudly welcome the guest of the day, Dr. PAVITRA Gaur. Welcome.
Thank you so much, sir, for inviting me again. Let me share my... Am I audible, sir?
Yes, you're audible.
Okay.
You can share now.
Okay, sir. Okay.
Yes.
So, okay, sir. Good evening, everyone. And for today's lecture in IFPH, I'll be presenting regarding VIPERA, the Venus story told through segments and cycles. So, what are we going to do today, actually? Today, we'll be exploring one of the most fascinating remedies in homeopathy, as you all will agree. Vipera, which I like to call the Venus story, Vipera beautifully represents what happens when the venous circulation loses its tone, when stagnation, swelling, and congestion dominates the system. Through the concepts of segments and cycle, we'll understand how the body passes through different stages of release, weakness, force, swelling, and inflammation. Each stage will describe not just pathology, but a deeper dynamic of human suffering. So let's begin this journey through veins, through the story of Vipera. So a brief description regarding about vipers. So vipers, as you know, is a genus of venomous snakes widely distributed from North Africa all the way up to the Arctic Circle, extending into the parts of Asia. This wide adaptability already tells us something, that Vipera has a capacity to survive extreme environments, to withstand tremendous physiological strain. From a toxicological point of view, as we can see, viper venoms affect the vascular endothelium and coagulation cascades. It leads to capillary leak, which leads to capillary leak syndrome, where plasma escapes into the tissues, producing edema and hypotension, abnormal clotting or thrombosis, resulting in local or systemic congestion, then neurotoxic and myotoxic effects, disturbing muscle movements. Clinically, such a picture can manifest as tachycardia, hypotension, or even hemorrhagic shock. So, components can lead to a widespread destruction in the body, usually a capillary leakage, neurotoxicity, tachycardia, and hemorrhagic shock. So, in homeopathy, we use this same pathogenesis to understand the specific action of Vipera. It primarily acts on venous system, especially where the return circulation is sluggish, leading to varicosities, phlebitis, ulcers, and bluish discoloration. So vipera is usually related with the all the diseases which are related to the veins, like inflammation of the veins, which we call in medical term as phlebitis, or the ulcers, venous ulcers, or even the DVTs, deep vein thrombosis, or the bluish discoloration, which are the varicosities, which is the most commonest complaint in the patients which we usually deals with. Now, natural characteristics. The natural behavior of viper mirrors its remedy pictures. since these snakes are found in cold climates and high altitudes, often surviving where other species cannot. They are nocturnal and capable of prolonged hibernation, which corresponds to a latent, slow moving, deep seated pathology in our patients. They attack suddenly and without warning, striking with precision, injecting a large dose of venom in a single blow, then retreating swiftly. Think about it now. This reflects the sudden and intense attack of vipera pathology, the abrupt onset of swelling. So the natural characteristics of vipera also corresponds to all the segment from the cycle, that how a vipera patient is going to act in the different segments and the cycles of vipera, which I am going to discuss today in the lectures today. So the acute throbbing pain of a varicose vein or the rapid development of the hemorrhage and collapse. It's sudden, forceful, but short, leaving behind exhaustion and destruction. So, what vipers do usually, they attack without warning, attack accurately, lightning speed, and leave swiftly, leave no chance for escape. Sudden single strike, but more poison. So there is a rapid development of everything. So even if on the pathological plane, when you see, there will be a rapid development of hemorrhage and collapse. So it's sudden, forceful, but short, leaving behind exhaustion and destruction. Now here comes the main thing which I'm going to discuss is the segments and the cycle. So this model of segment and cycle is inspired by Dr. Paul Herskeu cycle and segment framework. Describe disease not as a static state but as a flow through recurring stages. So Vipera moves through five major segments. The first is release, second is prostration and weakness, third is the stuckness and the closed up sensation, fourth is swelling, and fifth is inflammation. So based on these segments and cycle, the vipera is being divided and it helps us to remember it more precisely. Okay, so beginning with, so each stage compensates for the previous one. The patient's body, mind, and emotions move cyclically, releasing when congested, collapsing when drained, closing up when overexposed, swelling when blocked, and inflaming when pressure builds up again. So now here comes the first segment, which is the release segment. So in release segment, we usually see that how it will appear in the form of bleeding, vomiting, urination, and perspiration. So in the way, if a person has so much congestion in his or her body, so these are the way in which the segment is being, or the things are being released out from the body, which can be in the form of vomiting, bleeding, urination, and perspiration. So, in the release phase, the body attempts to relieve the internal pressure through discharges, vomiting, bleeding, urination, or perspiration. This presents a purging response, a desperate effort to clear congestion and toxicity. So, there's a desperate effort to release any kind of congestions which is being built up in the body and the toxicity which is being built up in the body. Because since the things are being built up and they are stuck up in a stuck up sensation, stuck up motion. So to in the form of releasing that vomiting, bleeding, and urination and perspiration. So this segment indicates that. For instance, bleeding may occur from nose, gums, bladder, or uterus. It often brings temporary relief by unloading the venous congestion. Now, since bleeding can come from a number of causes and focuses on various locations, for example, nose, gums, bladder, or uterus. Nose in the form of epistaxis, gums in the form of scurvy that we know, bladder in the form of menorrhagia, metrorrhagia, or uterus. Definitely menorrhagia and metrorrhagia are the conditions which might relate with bladder or uterus affections. It relieves congestions which on some level is benefit for the patient. So vomiting occurs during the time of anxiety or infection, a cathartic release of physical and emotional tension. Vipera also has a peculiar keynote, headache ameliorated by urination, showing how discharge brings comfort. So, vomiting, bleeding, and another urination and perspiration. So, these are the form in which the things which are being built up in the body or the toxicity which is being built up in the body is released in Vipera. So, vomiting usually occurs when a patient is extremely stressed or in an anxious state, or from the injury, or from the pain or suffering that comes with the severe infections, usually the staphylococcal or the streptococcal infections, which are being mentioned in the literature. So these kind of infections usually result in relieving the stress on the anxiety which are being caused because of an infection, and these are released out in the form of vomiting. Vipera shares the keynote of having a headache ameliorated by urination. Now, this is a keynote which has been found in the Vipera medicine. Then what happens when there is excessive release? Now there are some compensatory mechanisms. Like if there is excess release from the body, there are some compensatory mechanisms which are activated just to cumbersome that process of release. So what happens? The organism is trying to detoxify, but when this phase is prolonged, so when the release phase is extremely prolonged, it overshoots, it sets the stage of collapse. When there is extreme release of the discharges from the body, it results in collapse of the patient. So when release segment overshoots, what happens when release segments overshoots? When the release continues excessively, it becomes pathological. So initially, it was on the physiological plane that the patient is experiencing symptoms of vomiting, discharge, any kind of discharge, bleeding, or something like that. But when it continues, when the release segment continues, it becomes pathological. The bleeding turns profuse, prolonged, and unrestrained. The blood loses its vitality, it becomes dark, thin, or clotted. Mucosa and skin turns bluish or mottled, and the affected parts may even ulcerate or slough off. Here we see a transition from life to decay, a symbolic decomposition. So in this stage, when there is excessive release and when the release segment overshoots, the body is in a state of collapse. State of collapse, along with that, the body is in the state of decomposition. So in vipera, when the bleeding, vomiting, or perspiration goes on until they eventually aggravate in some way the patient, for example, the swelling and weakness of the venous circulation leads to excess bleeding, which, if unchecked, results in blood which becomes black, dark, and thin. This can also be true of menses, where the blood is dark and may be clotted. So there is a pathological decay which has been seen in the overshoot segment of the release. And what is being seen in the dermatological aspect, that the skin turns black and blue, the surrounding skin is mottled, eventually the top layers of the skin may fall off, or an injury that begin to ulcerate and produce pus. It may shows little inclinations to heal. So when the release segment overshoots, there is a little inclination to heal, and the patient is being inclined towards the pathological damage in the body, which is usually irreversible damage. The damage which is being which will appear in the body is not reversible. So however, the body that tried to relieve itself now loses control. So, from the release segment, the body was trying to release whatever the toxicity which was being built in the body. So, the body was trying to release it. But now, in the process of releasing something, now the body loses its control. So, mentally, there is also the patient will feel something. What they will feel, that mentally the patient will be delirious, restless, or discontented. They may move about or scream, crying for help. And however, this is the keynote, that in vipera the excitement is physical, driven by vascular disturbances and pain, unlike lachesis, whose agitation is more emotional and talkative. Eventually, the vital force weakens and we enter the next phase. So, in the release segment, even the mental picture of the patient is seen, and the patient is seen quite restless, discontented, means he's not satisfied of whatever is going in his or her body, wanting to move from here and there. He may only move his limb, but as the disorder becomes more severe, he will start pacing, yelling at you and at anyone to do something to help, like he needs that kind of help just to just to just to avail that thing which is going on in the body, and the patient is not being able to control that. So as a point of comparison, usually the vipera patient is not active as the lachesis is in similar circumstance for the symptoms. In vipera patient, the symptoms are more in the physical plane, in the physical realm, and in the lachesis medicine, the symptoms are more in the emotional sphere. So this is another differentiating point between the Ophidia group, between the vipera and the lachesis. So Eventually, when the vital force weakens and we enter into the next phase. Now, the next phase is the weakness and prostration. So, what happens in this segment is marked by collapse and exhaustion. So, when there is tremendous release of discharges or the release of discharges in the form of vomiting or urination or in the form of menses, when there is extreme menstruation. So, what happens is after that the patient is so much exhausted and collapsed because of the discharges that the patient enters into the next stage of weakness and prostration. What happens is the vital energy is drained after excess release, so the body is in the state of collapse that the vital force is also that much weakened that it is not being able to um, cope up with the release of all the discharges that has appeared in the body in the first segment. So what we will see: extreme prostration, faint and thready pulse, cardiac weakness, and venous dilatation with loss of tone. So what happens in this segment is there is loss of tone in the venous circulation and the venous dilatation. So probably the dilatation of the vessels, especially the vein, is being lost. The tonicity is being lost. There is a cardiac weakness, and when we will feel the pulse usually will be faint and thready pulse. So the veins in the leg loses their elasticity. So the elasticity is lost and valves fail one after the another. Patient complain. What will what will be the patient complain when he will visit a doctor? That doctor, my legs feel tired as if I have been standing for hours. So a patient usually will say that my legs feel tired as if I've been standing for hours. For the prolonged standing, aggravation from prolonged standing is one of the symptom which we will see in weakness and prostration segment. So they must elevate the limbs for relief. In chronic vipera states, you may even find post stroke weakness where circulation and tone are profoundly affected. Symbolically, this is the stage of hopelessness. Now, this stage, there comes an emotion which is hopelessness. The system feels defeated, heavy, unable to sustain effort. So, in weakness and frustration segment, there is a feeling of hopelessness, along with there is loss of tonicity, elasticity, thready pulse, faint pulse, and the patient is unable to stand for prolonged hours. And even if the patient is been standing for prolonged hours because of his or her occupation, he will usually get relief from lifting up his or her leg or limb. So a weakening of the heart can be seen in the chronic vipera patient, with the heart beating weakly and the pulse becomes so thin that it cannot be felt lower down on the forearm. That much thready pulse will be. Extreme prostration when the patient has discharged by screaming, expressing great anxiety, or when intense pain has been going on. So, after the release segment, the weakness and the prostration segment, there will be extreme prostration. The weakness manifests in the formation of varicosities due to poor tone of vessels. The elasticity is being lost, so there will be varicosities which will be developed. And in the legs, valves of the vein fail one after the another. The patient will say that her legs feels tired as if she has been on them for many hours and need to prop them up. He wants them to lift them up after prolonged standing. So this was all about the weakness and prostration segment. Now we will walk for the another segment. Acha, okay. Before walking for another segment, there are another keynotes of the second segment, which is prostration. That is generalized tiredness, intense weakness, and hopelessness. And there will be utter prostration is also seen in some post-stroke patients, which I've already discussed. There are several characteristics to stroke of vipera. So vipera is one of the medicines which are usually given, which can be usually given or which can be prescribed in post-stroke patients recovering after a stroke, or uh, when there is intense weakness and generalized weakness. So moving on to the third segment, that is the stuck and the closed up segment. Closed up segment. So what happens in this segment is, now to protect itself from further collapse, the organism begins to close up. So after the release segment and after the weakness, the generalized weakness, there comes the third segment, that is the stuck and the closed up, which the body has to do. Why? In, to avoid the sudden collapse, to avoid the further collapse of the body starts closing up. And what happens in this segment is The patient feels too open, too vulnerable, and so the body locks in. After the extensive release of everything from the body and of that devastated and the exhausted feeling, the patient thinks that he's too much vulnerable and he's too open, like he has discharged so much of energy and everything. Now the body tries to locks it. This manifest how this will manifest physically as formation of tumors, cysts, fibroids, particularly in the uterus and breasts. So any kind of enlargement, the psychotic tendencies which appears after the extreme release and the prostrated segments like the tumors, the lumps, and the fibroids, the cysts, the tumors which are being formed in the uterus and the breast comes under the lean in the third segment, that is the stuck and the closed up sensation. The skin eruptions that are raised, thickened, and keloid-like. So there are different kind of skin eruptions which are also seen, and these are usually raised and thickened and keloid, like the papillary eruptions. Usually the papillary eruptions that are raised, thickened, and keloid-like. Blisters that turn dusky blue, later ulcerating or filling with pulse. Inside the vessels, this stage corresponds to thrombosis or phlebitis, a pathological closing of the veins. So now in this state, what happens is there is a pathological closing up of the veins. So this results in thrombosis, like building up of small clots in the veins and the inflammation. After the release, the veins are being closing off. After the loss of tonicity, now the body is trying to cope up with the mechanism, and now it's trying to closing up in the form of thrombosis or the phlebitis. So in order to stem from the prostration and weakness caused by the over release, what vipera patient will do in this segment is will begin to close up. It has a tendency to feel open, just like phosphorus. Now vipera has been compared with phosphorus. So how does a phosphorus personality will react? It's a diffusion kind of personality, easily diffusible personality, as we see. So phosphorus, just like phosphorus, is vipera, but vipera is like phosphorus in segment 1, that is the release segment. Now how, like, it has a tendency to feel open, but when there is extreme tendency to be open, it at the later stages it becomes vulnerable, and at that vulnerability stage the patient will tries to close up. Okay, so they feel exposed or weakened, hence developing the desire to close up to protect themselves. So basically what happens is, after being so much exposed to the external environment or weakness and there is a desire of closing or to protect themselves from the external influences. We see this in many ways in vipera patient, for example, in the desire for an ability to create closed off structures like tumors, lumps, and more specifically in the uterus and breasts. So there are basically the tumors, and they also have a specific location, especially in the uterus and breasts. Now, another skin eruptions which we can see in vipera patient are, these are generally not flat. Now, they are not the macular eruptions; they are papillary eruptions, and later on they can be the pustular eruptions. So, generally not flat, but appear as raised pimples or vesicles, and are listed in materia medica as scarring, which is thickened and keloid-like. So, keloids can be one of the guiding symptoms or for the vipera patient. The skin eruptions often become infected around the site of injury, starting out as reddish blisters and eventually turn dusky blue as the initial site becomes gangrenous and pusculed. So eventually there is pathological destruction which is being carried out in the body if the segments are being not being controlled. So eventually there is a pathological destructions in the body. So what in the stuck up or closed up segment, we will see that patient will be, it has a desire to close off just to protect themselves, and then there is a formation of structures like tumors and lumps, especially in the uterus and the breast, and in the skin eruptions which are usually not flat but as raised pimples or vesicles, and are listed in the materia medica. And especially clinically, if we will talk about, there will be formation of thickened which are usually the keloids, and skin eruptions usually will become infected around the site of the injury, starting out as reddish blisters, eventually turn dusky blue as the initial site becomes gangrenous and pusculed. Okay, so it's the limbs usually. Now moving on is the same part of this segment is the most well-known irregular vasculature is found in phlebitis or thrombi, which can cause stroke. So formation of thrombi in the vessels or the inflammation of vessels can eventually leads to stroke. Those vessels which are visible from outside may appear blotchy and lumpy just because of closing off. They may appear blotchy and lumpy, while the overlaying skin looks unevenly vessels unevenly vessel, which we can see in the patient usually coming with varicosities or the tortuosities of the veins, which we usually call. When there is a prostration following profuse release in the form of swelling and bleeding, it is not surprising that the body finds a way of holding on in order to curb the release. Just in order to curb the release, the body will try to hold up in the situation, and usually if it's related to the veins may appear dilated, tortuous, and there might be formation of thrombi, and of course there will be inflammation of veins. Thus fluid and tension builds in the leg to a point that legs can hardly be bent. So there will be so much tension and presence of fluid in the legs that legs cannot be bent. So in the stuck and the closed up segment, we will see that there are closed up structures, tumors, lumps, along with skin eruptions, and again, then there will be the formation of thrombi, the inflammation of veins, and which can eventually cause stroke, and then there might be build up of intense pressure and fluid, which will at a point leads to uh, that much sensation that the legs can hardly be bent. So the limbs may appear blotchy with unevenly distended visible beneath the skin. It's basically a defense mechanism. The body tries to hold everything inside to prevent further loss, but in doing so, the circulation stagnates and suffering intensified. So when there is a closing up of structures, the circulation will eventually be stagnate. It will not flow, and if it stagnates, it results in building up of tension in the legs, and suffering will intensify. Okay, moving on to the fourth segment of vipera, that is swelling. Okay, now what will happen that, and this brings up to the vipera's hallmark. Now this is the vipera's hallmark, and that is swelling. What will happen in the swelling segment? This is the signature keynote symptom. Now it's a signature keynote symptom. Veins are swollen, tense, and feel as if they will burst when the limb hangs down. Limb will hang down. Okay, so when the limbs will hang down, what happened? The swelling is due to venous congestion, okay, lymphatic stasis, and weakness of the heart leading to dependent edema. So what will happen in swelling segment is there will be venous congestion, lymphatic stasis, and weakness of the heart leading to dependent edema. When the legs is lowered, the patient experiences excruciating and bursting pain. The only relief comes when the limb is being elevated. So what results from this excessive closing of is terrific swelling. So there will be terrific swelling involving the lymph channels and the veins. This is where we find out the most famous keynote symptom of vipera. We see varicose veins so swollen and pulsating that they will feel like they will explode, especially when the limbs will hang down. It is found quite often in the chronic vipera patients, especially women, and in pregnant women who suffers with most excruciating varicosities. So Vipera is usually useful in chronic patients who suffers from uh, the excruciating varicosities, and the conditions might be in pregnant women. Okay, and the swelling in the chronic vipera patient is often due to a slight or sometimes severe weakness of the heart. Okay, so swelling might also occurs when there is severe weakness of the heart. The weakness leads to fluid accumulation that cannot find gravity, so the gravity makes the fluid pools in the part that hangs down below the level of the heart, that is the limb. So why there is excessive swelling of the limb is just because there is a weakness of the heart, and the weakness will eventually lead to fluid accumulation, and that cannot fight the gravity, so gravity makes the fluid pool down into the parts that hang down below the level of the heart, that is the limb. So this was about the swelling segment. Okay, so pregnant women, what are the takeaway notes for the swelling is pregnant women with severe varicosities, chronic cases of venous insufficiencies, post-thrombotic or phlebitic conditions, and this is the stage of accumulation when stagnation reaches its peak. So stagnation will starts in the previous segment only. That is, the previous segment was our stuffed and the closed up sensation, but in the swelling segment, the stagnation will reach its peak, and when it will reach its peak, it will be hardly impossible to bend the leg. Okay, and it will feel so heavy, and sometimes the patient will say that my limbs are so heavy that I cannot hang them down. So this is the these are the keynotes of the swelling. What are the keynotes? I can repeat it again. Is varicosity, especially in pregnant women, chronic cases of venous insufficiencies, post-thrombotic or phlebitic conditions, and the relief will always appear when the limb is being elevated. Okay, and lymphatic stasis, weakness of the heart leading to dependent edema. So there will be dependent edema. So this is the stage of accumulation when stagnation reaches its peak. Now another segment, that is inflammation, festering, tenderness, pain segment. Now, after the extreme swelling, which is the main keynote of Vipera, there comes the inflammation, festering, tenderness, and pain segment. In the final segment, the swollen, stagnant tissues becomes inflamed and painful. Now there will be extreme inflammation and swelling, which is being felt in this segment. So swelling eventually leads to inflammation, and inflammation will lead to another symptoms, phlebitis or deep vein thrombosis in legs, in which the legs become red and feels hot and swollen, staphylococcal or streptococcal skin infections which are red and abscessed. The skin forms pustules and will eventually peels off. Severe gastroenteritis, here the abdomen swells and is full, and the mouth becomes dry, and the tongue looks burned, dry, and discolored. So what will happen in the inflammation or the festering segment is, if in the veins we will see there will be medical condition or the clinical conditions, phlebitis or deep vein thrombosis because of the formation of the thrombus in the stuffed up or the closed up sensation segment, in which the legs will become red and feels hot and swollen. Then the staphylococcal or the streptococcal skin infections, which are usually red and abscessed, and the skin forms pustule which will eventually peels off. And then if we will see in GIT, there will be gastroenteritis. Here the abdomen will be swollen and is full, and the mouth becomes dry, and the tongue looks burned, dry, and discolored. Okay, so now phlebitis or deep vein thrombosis, where the legs become red, hot, and tense. Suppurative skin conditions, especially staphylococcal or streptococcal abscesses that discharge pus and forms ulcers. Even gastroenteritis, which I've already discussed, the abdomen is distended, tongue dry and discolored, showing systemic inflammation. So this inflammation is not on just on the physical realm; it also manifests in the mental plane. So what happens emotionally? Emotionally, VIPERA patient suffers mental inflammation. So what happens in mental inflammation? There will be anxiety, agitation, restlessness, and even delirium due to pain and fever. Okay, so on the physical plane, we've seen that patient might suffer from DVT, might suffer from phlebitis. There might be skin conditions, there might be gastroenteritis, abdomen will be swollen, tongue will be dry. But on the physical mental plane, the patient will be emotional inflammation, which we will see is highly anxious state. This can occur when an injury causes excessive pain. The patient tosses and turns, even scream from the pain, and cannot be calmed down. Fever often accompanies the state, and if the pain is severe, the patient may become delirious. So this is the physical this is the mental realm on which the patient will stand, and emotionally the patient will be extremely anxious just because of the pain which the patient is experiencing. And when this phases reaches its height, the body again seeks release, returning us to the first phase of the discharge. So what will happen is, again the same cycle will continue after the inflammation, festering, and tenderness and pain segment. So, repeating it again, swelling, inflammation in the form of phlebitis, deep vein thrombosis, in which the leg will become red and will feel red, hot and swollen, streptococcal skin infections, which are red and abscessed, severe gastroenteritis in the form of abdomen, which is swelled up and is full. The mouth will be dry and tongue looks burnt, dry, and discolored. Inflammation is not only related to physical relief but also on the mental plane. Mental plane, there will be highly anxious state. This can occur when injury, excessive pain causes excessive pain, and the patient tosses and turns, even scream with pain and cannot be calmed down. Fever will accompany the state, and if pain is severe, the patient may become delirious. Okay, so after this phase will reach its height, the cyclic pattern will continue, because the body will seek the release again, returning it to the first phase of the release segment, which we have discussed in this session. So thus, Vipera lives in a perpetual cycle of release, collapse, closure, swelling, and inflammation. So this is about the segment and the cycle approach of the Paul Herskew, which he has discussed. So there's a perpetual cycle of releasing, collapsing, closure, swelling, and inflammation. Now, with the inflammation, festering, and tenderness, our cycle of Vipera is complete. So we have completed a complete cycle of how many segments? I guess 5 segments. So now the cycle begins again with releasing or discharging in order to gain relief from the swelling and inflammation. So we see how the patient becomes trapped in this cyclic pattern of illness. And just to get help patient of getting rid of all the symptoms, we need to break this cycle. We need to break this cycle um, uh, in order to avoid getting the patient into another segment or the last segment. So at that so it's very much necessary to know the which at which segment the patient is coming, and thus that segment corresponds to that Vipera symptom or the keynotes. Okay, now I would like to discuss some of the stalwarts experiences with Vipera. So first one is Dr. Leonard. What he did, he administered Vipera to a lady suffering from climacteric hemorrhage with dark clots, faintness, and prostration due to a small fibroid. And after few doses, the hemorrhage ceased and never recurred. Okay. Another case was a nursing mother exhausted by prolonged bleeding and daily nosebleeds failed to respond to China 200, but Vipera CM cured her complaints. Dr. Allen reported a gold beater whose right arm veins become enormously swollen and painful. He couldn't even let his hand hang down. Vipera provided immediate cure. Then Dr. Swan also noted that Vipera's remarkable action in epistaxis and mentioned its chronic periodicity. Symptoms recur annually, sometimes ending in paralysis or gangrene. So each of these illustrates Vipera's profound affinity for venous congestions with collapse, whether uterine, peripheral, or cerebral. So these are the stalwarts who actually worked with Vipera, and Vipera gave them results too. Like for a lady suffering from climacteric hemorrhage, uh, got a relief with a few doses, and the excessive hemorrhage does not return. Another, a lady nursing a child a year old, was much prostrated by hemorrhage lasting several weeks, not profuse but continuous nosebleed nearly every day. Weaning brought no relief. China 200 did no good, but Vipera in CM cured in 3 doses. Another, which I've discussed, which was documented by Dr. Allen, is he found that a gold beater found the veins of his right arm become exceedingly swollen and painful, so that he could no longer work or let his arm hang down. Vipera cured immediately. Another, which Dr. Swan has documented, said Vipera was the remedy for all form of epistaxis. Vipera has a chronic and periodic action. The symptoms return annually for years. The parts may be paralyzed and ulcers and gangrene follow. A sensation as if something ran up the thigh occurred in beaten limb in one case. In one case, there was a sweat over the body except the beaten limb, over the whole body except the beaten limb. So these are the documented documented things which our stalwarts have seen and got results with Vipera. Okay, so these are some of the rubrics in which the Vipera is listed, and this is usually from which I have taken is from this synthesis repertory. So in mind there is speech which is delirious, mind speech hesitating, mind speech inarticulate, mind speech incoherent, mind speech intoxicated as if, irrational talking with sleeplessness and pain, wandering as if drunk, answering mumbling incoherent, tongue swollen protruding, speech difficult, mind ambitious increase, mind ambition increased competitive, mind duty too much sense of duty, mind duty too much sense of duty, children. Okay, so these are the references from which I've taken the matter. But what are the takeaway notes of today's lecture is regarding Vipera. It's Vipera and its affinity towards the vessel, especially the veins and the different segments which I have discussed, starting from the release segment, then the prostration and the weakness, the stuckness and the closed up, swelling and inflammation. In the release segment, which a patient might present with is vomiting, bleeding, urination, perspiration. Then the bleeding comes from a number of causes, and here from this segment we will get a keynote, and that keynote is of having a headache which is ameliorated by urination. Then excess of anxiety from pain, injury, or swelling that comes with severe infection, which is also ameliorated by any kind of discharges. Okay, then we have already learned about the release segment which will overshoot, and when it will overshoot there will be a pathological destructions in the body. The blood will become black, dark and thin, and menses which a patient might manifest with is the blood will be dark and maybe clotted. The skin will turn black and blue, and surrounding skin is mottled, and it may or the injury that might begin to ulcerate and produce pus, and there will be a little inclination to heal. Moving on to um, same segment, that is the patient will be quite delirious, discontented, wanted to move from here and there. He may only move his limb, but as the disorder becomes more severe he will start pacing, yelling, and he will ask something to do with him as he is not satisfied for whatever he is facing. Okay, and another differentiating point which we have learned in the over release segment is the symptoms, or the physical dream is more pronounced in Vipera patient, and the emotional plane is more pronounced in the Lacasis patient. Then the second point. The second is the weakness and the prostration. In the weakness and the prostration, the takeaway notes are there will be a heart which will be beating weakly, the pulse will be thin, and it cannot be felt lower down on the forearm. It will that much be thready pulse. Then there will be extreme prostration, and extreme prostration which after the discharge discharge in the form of screaming, expressing great anxiety, or when there will be intense pain that has been going on, and the weakness which will be manifest in the formation of varicosities due to poor tone of vessels, and the patient will say that the legs will be feel tired as she has been on them for many hours, and she needs to lift them up or to prop them up. Another, the takeaway notes, generalized weakness in the prostration and the weakness segment, intense weakness, hopelessness. Mentally, the patient will be hopeless and he will try to say that please help me as I'm not satisfied for whatever things I'm facing in my life. Please help me. Utter prostration. And post-stroke patients, usually in post-stroke patients, there might be utter prostration which will be seen. Then in the third segment, stuck and the closed up, there the takeaway notes are there will be structures, especially closed off structures like tumors and lumps, which will be in uterus and breast, skin eruptions, which will be raised not flat, they are not macular eruptions, they are papillar or pustular eruptions in the pathological condition. So in papillary eruption, there might be a clinical condition which we usually deals in our day-to-day life, and patient usually comes with a skin condition that is keloid. So keloid, and then there will be, if there is a site of injury, it will become infected, and there will be reddish blisters, and which will eventually turn blue, and initial site becomes gangrenous and pus-filled. Then there will be phlebitis, there will be thrombi, which can cause stroke, and then there will be swelling and bleeding, and there will be fluid and tension builds up in the leg to a point that can hardly be bent. Swelling segment, the takeaway notes: excessive swelling in which the patient usually seen in a chronic vipera patient, especially women's and in pregnant women who suffers with most excruciating varicosities. There will be extreme pulsating sensation, and it will give a sensation to the patient that they will explode, especially when the limb will hang down. So it is quite often seen in chronic vipera patient. Okay. Another takeaway note: the swelling in chronic vipera patient is often due to slight or sometimes severe weakness of the heart. The weakness leads to fluid accumulation that cannot fight gravity. So it results in pooling down of blood in the lower limb, and because of that, there will be swollen limb or the edema, which will be seen in the lower extremities. Then inflammation in the form of phlebitis, deep vein thrombosis, staphylococcal or streptococcal skin infection, or severe gastroenteritis, in which there will be swollen abdomen and full, and there will be mouth which will be dry, tongue looks burnt and dry and discolored, not only related to the physical dream but also on the mental dream. The inflammation might manifest as an anxious state, and this can occur when injury causes excessive pain. There will be excessive pain which a patient might feel. The patient might tosses and turns in agony, even scream from the pain, and cannot be calmed down. Fever might also accompany the state, and if patient is severe, the patient may be delirious. Okay, so these are the segments, and after the inflammatory segment, festering and tenderness cycle of vipera will continue, and to break that cycle, we need to prescribe it first. Before that, we needed to learn regarding these segments. So this is a cyclic pattern in which the patient is being wrapped upon. Then there are the stalwarts which had their experiences with vipera. I discussed that, like Leonardo, Dr. Allen, Dr. Swan. These were the rubrics. So this was all about today from my side.
Thank you, Dr. Pavitra Gaur. Really an excellent session. Nobody thought so much of things were there in the uh, presentation, but you really enlightened us and take us to a new world. That's
Thank you
what I
so
would
much,
like
sir.
to add. I'm inviting Dr. Sweda. She is actually the moderator of the day. Unfortunately, there was some network problem. She couldn't uh, join at that time. Anyway, Dr. Sweda, you can make.
Yes, doctor. Good evening, everyone. And sorry for the inconvenience, first of all. Then I listened the session from the first doctor. Really, your session was very nice. Throughout the
Thank
session, you kept your flow, you made flow perfectly. And each of your words were very clear and very attractive. And also, you delivered the pick in most impressive in a different way. Your session was really nice, doctor. You explained everything in a clear manner.
Thank you so much.
So actually, most of the people may used to prescribe this Vipera as and when they are not getting result after giving either laxatives or the constitutional remedy as right or left laxatives like a podium or something or some. Actually, if the picture is clear and well cut, then you can definitely go ahead with this Vipera a lot.
Definitely, there are so much unexplored remedies in homeopathy which actually needs to be, like come into the center focus. and needs to be learned in a different way. So I tried it to present in that way that it's more exciting to
It,
learn.
it was just like reading a polycourse in a Mathematica. That much of the content, and that's beauty of your presentation, and you are really able to differentiate what are the cycles through which the same medicine goes on, and when what are the things that one need to look into when such a patient comes. For example, the swelling alone, the coloration of what can be the color of the skin and how the color changes, and everything was beautifully discussed. And what the Dr. Allen has to say, what Dr. Sven has to say, all those things, and that means you really um, done a great research work on Vipera. That's why you got such things, and you are able to produce the mental symptoms in a beautiful way also. And
Yes, sir.
actually, we all know that most of the rare remedies have no head and tail. Only the physical part is always described in the textbook, and upon which we used to prescribe it as a complementary or just as a partial simile. And
Yes, sir. And
but
mostly
now
there are group of medicines which are already, usually we discuss those group of medicines only, and some of the beautiful remedies are left out. So I tried to present something different, to give something different to IFPH. I hope it was
yes, yes,
up to the mark.
yes, definitely. Uh,
Yes, sir.
those who want to participate can also join the discussion, and you can ask your question also. I think Dr. Deepamala is here. Doctor can say something on that. Dr. G. Harikumar sir is also an expert in this field. Dr.
Okay.
Harikumar sir, you can also come out and make your statement on this presentation, sir. Please, if possible, kindly unmute yourself. And Dr. Harimar is a person who is having MBBS, VHMS, and no, MD in homeopathy, then MD in Ayurveda, and all these things
Okay.
together. No. Yes, yes, sir. Please, if possible, kindly come out. Those who want to participate in discussion can. Somebody, please go through the. Dr. Sheda, is there any question in the chat box?
No, doctor.
No,
There's one appreciation message alone is there.
only appreciation. Oh, okay. Uh, uh, Dr. Sheda, no, Dr. Pavitra, have you ever experienced these things in your practice?
Sir, not really actually, but I am trying that I should try these medicines which are not explored further, just to make them more clinically sound, and they, the use of these medicines should be in a regular uh,
Way,
thing, like another
exactly.
medicine, different, like the
Just
same
like
medicines which you are prescribing.
yes, the same intensity with which one practice with the Copernicus, we can use this. That's what your presentation is all about. And I'm inviting Dr. Rambaresh, sir. Have you,
Thank you.
yes, sir, what's your experience
Ah,
with this?
thank you, Dr. Dhanesh ji and Dr. R. Sweta. Congratulations, Dr. Pavitra Gaur. Heartfelt thanks to Dr. Pavitra Gaur for sharing valuable insight on Vipera medicine. Vipera
Okay.
medicine is a very good medicine, or yani some medicine is the attack without warning. The
Hmm.
attack without burning, some medicine condition. So Vipera attack without burning, sudden venous congestion, bruising, and attack without warning. Understanding aggravation, uh, etc. Lachesis attack without warning. Lachesis attack without warning. Sudden attack mostly left-sided. Paralysis, etc. है ना? Crotalus. Crotalus is a very important remedy. Sudden attack without warning. Septic or hemorrhage. Crotalus. है ना? तो trembling and jaundice, etc. तो tarantula attack without warning, sudden burning and inflammation. Sudden burning, attack without warning. So very, very thanks, Dr. Pavitra Gaur, dynamic lecture, excellent session, and you are dynamic personality.
Thank you, sir. Thank you so much.
Just like homeopathic medicine is the dynamic, and Pavitra Gaur is the dynamic personality. Very, very thank you.
Thank you so much, sir.
Dr. Veeran Namak is there. Yes, sir. You can speak now. Dr. Veeran.
Nothing, sir. It is just accidentally touched. Very good session, sir. I have also heard some last part, but it is good. Thank you, sir.
Okay.
Thank you,
Yes.
sir.
Yes, Dr. Seda, now we can invite Dr. Boblin for auto thanks.
Okay, doctor.
Dr. Bob?
Thank you, doctor. And now I invite Dr. Boblin to convey the thank you session.
Oh, no. I think he's now not in the
He's there. He's
yes.
Yes.
Can you hear me? Sorry, I
Yes.
cannot
yes,
see me right.
doctor.
Okay. Today's session from Dr.
Pavitra.
How to pronounce? Dr. Swesta.
Pavitra.
Pavitra Gaur.
Pavitra. Okay. Dr. Pavitra has gone through a very detailed what they call that, the information about VIPERA, the Viper too, and she has described it very, very nice and clear to us, and she repeat over again so that we can know by heart today about VIPERA, and that is very, very good, and very clear, simple, and detailed and nice. And I'm sure that we can apply this for our practice. When we face patients with this type of condition, it's more less physical general. And that is very good, Dr. Pavitra, for tonight's session on this webinar. On behalf of the IFPH, I would like to say a big thank you to you and our gratitude for sharing this session. And I hope that you can come again next time. I'm sure you have many things to share, especially
definitely, sir.
With patients with the case taking. Then we can go through example of this case taking on the patient where we prescribe VIPERA, and that will be very good for all of us. Okay. And thank you very much, Dr. Pavitra. Once again, and over to you, Dr. Danesh.
Yes, doctor.
Thank you, Dr. Boblin. Is the pillar, one pillar of our IFPH. And Dr. Rama Devi Ambani, namaskar.
Namaskar. Acha laga.
Thank you.
Namaste.
Okay.
Thank you all doctors for attending today's English session. And we can wind up the session, and I'd like to hand over the session to next session's host.
Okay, before that, tomorrow we will have a session from Dr. Shalini, and Dr. will be talking about thyroid and its homeopathic management. Thank you all. Good night.
Thank
It's
you
up
all.
to,
Doctor.
it's up
Har
to
ghar homeopathic, har ghar homeopathy. Thank you.
it's up to Dr. P. Shaila to